My name is Cathy Dunnagan, and on July 30th, 2008, I was just like the rest of America, just perfectly normal, healthy life, except I was itchy. And on July 31st, 2008, my whole world turned upside down. We live out in the country. I would just go out and itch against our brick house. I wore the bristles off my hairbrush. And I only went to the doctor because I had so many sores from itching. So I went and my doctor did some blood work, realized my liver enzymes were high, scheduled some other tests, which is so out of character for me to follow through with anything. By the grace of God, I was diagnosed over at Barnes, West County with a very rare cancer, cholangiocarcinoma. And my only hope to live was Dr. Chapman's clinical trial for a liver transplant.
Catherine had cholangiocarcinoma, or bile duct cancer. It's a rare condition. There are about 3,000 people in the U.S. that have this every year. We suggested the idea of transplantation to her, and which she was very interested in considering. She would have considered anything to cure this.
Basically, the only two places in the world that had this clinical trial was Barnes Jewish Hospital or the Mayo Clinic. And my first little miracle is Barnes Jewish is 25 minutes from my front door.
She was a young woman. She was in her 40s. She had a daughter who I think at the time was in college, and she really felt like she had been given a death sentence.
And I remember asking Dr. Chapman, how long do I have if I don't get a liver? And he said 6 to 8 months. And that was my aha moment. And I just asked him then, will I see my daughter graduate? She's in college. Will I see her get married? And he was like, yes.
Catherine completed her chemotherapy, completed her radiation. She had a limited surgery, looked to be sure this cancer hadn't spread, and there was no evidence of that. She waited on the waiting list about 6 months, came up for a transplant.
I had my first transplant on May 24th, and I stayed for 11 days, which was a little bit long. And then on 4th of July, I woke up vomiting blood.
She developed some bleeding, and which required her to come back, and that was kind of a tip-off that there was a problem. We actually had to remove her liver.
Jeff was there by himself in the room, and he said he could just tell when Dr. Chapman came out that things were really bad. And Dr. Chapman told him that I have 24 hours to find her liver. And he said, Cathy, I knew he would. I didn't even feel like things were going to get any worse. I knew he'd find your liver. And he did.
She had a retransplant, and since then she's done great. Really no major problems since then. I think Catherine's prognosis is excellent. The further she goes out from the transplant, the less the risk of cancer recurrence. For cholangiocarcinoma, we have patients that come from all over the United States. I think we're somewhat uniquely positioned to do this because of our great support here, especially with our medical oncologist and radiation oncologist, our cancer center, our focus on liver cancer in patients that require transplantation. We take an aggressive approach for treating especially our cancer patients, but our other patients that have liver failure. So we take on cases that aren't considered at other centers, and we've been recognized for that.
I never knew that I was sick or I was dying until I was better. I had no clue because I was so well taken care of. I've never, ever received such great care or seen such great care. And I do have this wonderful picture that I gave to Dr. Chapman. We call it the moment. This is the moment Dr. Chapman promised me. This is when Caitlin graduated from college. He told me I would see it, and he was right. I mean, he is our hero.